Kolkata doctor rape and murder sparks nationwide protests demanding better workplace safety. Get all the details of this unfortunate incident. The tragic incident of the Kolkata doctor rape and murder has sent the entire medical fraternity into a state of tizzy. Dr. Moumita Debnath, a second-year postgraduate trainee at R.G. Kar Medical College in Kolkata, was raped and murdered on August 9, 2024, just when India was looking forward to the upcoming Independence Day celebrations. The incident has sent shockwaves across India and beyond. This heinous crime has not only highlighted the vulnerabilities faced by medical professionals, but also sparked widespread outrage and demands for systemic changes to ensure the safety of doctors, especially women, in the workplace. On the morning of August 9, 2024, Dr. Moumita Debnath was reported missing by her colleagues. She was last seen heading to a seminar hall within the college premises to rest after a long shift. Her body was discovered later that day in a half-clad state, with visible injuries indicating a brutal assault. The autopsy confirmed that she had been raped and strangled to death. The report detailed severe injuries to her genital tract, face, and other parts of her body, suggesting a violent struggle before her death. The immediate reaction to this crime was one of horror and disbelief. The medical community in Kolkata and across India quickly mobilized to demand justice for Dr. Debnath. Protests erupted not only in Kolkata, but also in various parts of India. Doctors, medical students, and healthcare workers took to the streets, holding candlelight vigils and marches to honour Dr. Debnath's memory and to demand stricter security measures in hospitals. The incident also drew international attention, with medical associations and human rights organisations from around the world expressing their solidarity with the protesting doctors in India.
আমি যতটুকু ইনফরমেশন পেয়েছি, আমি ছাত্রছাত্রীদের কোনো দোষ দিচ্ছি না। বহিরাগত কিছু রাজনৈতিক লোক যারা বাংলায় অশান্তি করতে চান, বাম এবং রাম, তারা একত্রিত হয়ে এই গন্ডগোলটা করেছে।
The Chief Minister blamed several viral videos for fanning the anger and appealed to doctors to call off their strike.
The global medical community condemned the attack and called for immediate action to ensure the safety of healthcare professionals. The investigation into Dr. Debnath's murder led to the arrest of Sanjay Roy, a civic volunteer with the Kolkata Police Disaster Management Force. Roy, who had a history of domestic abuse and was known to frequent the hospital, was apprehended after his Bluetooth headset was found at the crime scene. Despite his arrest, there were widespread calls for a more thorough investigation, with many demanding a probe by the Central Bureau of Investigation, CBI, to ensure impartiality and transparency. The Kolkata doctor rape and murder incident has sparked a wave of outrage and protests across India. The Indian Medical Association, IMA, representing over 3.5 lakh doctors, called for a 24-hour nationwide strike today, starting at 6 in the morning. This strike involves the suspension of non-emergency health services, including routine outpatient departments and elective surgeries, while ensuring that emergency services remain operational. The strike is a direct response to the brutal crime, demanding justice for the victim and the implementation of measures to protect healthcare workers. The medical community's response has been swift and unified. Protests have erupted in various cities, with doctors, nurses, and medical students taking to the streets to express their solidarity and demand action. In Kolkata, The epicenter of the tragedy, healthcare professionals have staged sit-ins and marches, holding placards and chanting slogans calling for justice. Similar scenes have been witnessed in Delhi, Mumbai, Chennai, and other major cities, where doctors have gathered outside hospitals and government offices to voice their concerns. The IMA has put forward several demands to the authorities. Firstly, they are calling for a thorough and professional investigation into the rape and murder case, with a specific timeframe for delivering justice. They also demand the identification and punishment of those involved in the vandalism of hospital premises following the incident. The IMA is advocating for an overhaul of the working and living conditions of resident doctors, including the implementation of mandatory security measures in hospitals to prevent such incidents in the future. One of the key demands is the enactment of a central law to prevent violence against healthcare professionals. The IMA has stressed the need for hospitals to be declared safe zones, with adequate security entitlements for doctors and other medical staff. This includes the installation of surveillance systems, deployment of security personnel, and strict enforcement of laws to deter any form of violence or harassment against healthcare workers. The strike has had a significant impact on medical services across the country. With routine OPDs and elective surgeries suspended, patients have faced delays and disruptions in their treatment. However, the medical community has ensured that emergency services and critical care remain unaffected, demonstrating their commitment to patient care even amidst the protests. The IMA has urged the public to understand the gravity of the situation and support their cause, emphasizing that the strike is a necessary step to bring about long-term changes that will benefit both healthcare professionals and patients. The tragic incident in Kolkata has also sparked a broader conversation about the safety and working conditions of healthcare professionals in India. Doctors often work long hours under stressful conditions, with inadequate security and support. The COVID-19 pandemic further exacerbated these challenges, highlighting the need for systemic reforms to ensure the well-being of those on the front lines of healthcare. The IMA's demands for better working conditions and security measures are not new, but the recent incident has added urgency to these calls for action. In response to the protests, several state governments have expressed their support for the medical community and promised to take steps to address their concerns. The West Bengal government, where the incident occurred, has announced the formation of a special task force to investigate the case and ensure justice for the victim. Other states have also pledged to enhance security measures in hospitals and improve the working conditions of healthcare professionals. The nationwide strike and protests by doctors have brought attention to the critical issues facing the medical community in India. The tragic rape and murder of the trainee doctor in Kolkata have served as a catalyst for change, prompting urgent calls for justice and systemic reforms. As the strike continues, it remains to be seen how the authorities will respond to the demands of the medical community and what measures will be implemented to ensure the safety and well-being of healthcare professionals across the country.